What's the treatment plan that anyone can adopt for their mental health?
I'm gonna keep coming back to self-compassion. So what I ask clients to do is ask themselves every day, you're my client, to say, what can I do for you this morning? What can I do for you today? What can I do for you in this moment to make you happy, to make you healthy, to make you comfortable? It's addressing yourself in a very loving and understanding way, a compassionate way. Sometimes we have a problem doing that, however, because as adults, we feel that that's either selfish or very natural. So what I'll say is, okay, imagine yourself as a 5-year-old. Does that person warrant compassion and understanding and direction? Of course they do. Well, that person is still in you. But if it helps you to see yourself in, in that capacity, then I think that's helpful. So that's number one. Because when you look at yourself with a self-compassionate eye, you are you're actually fortifying your self-awareness and your self-worth. So you understand, this is what I'm worthy of. I'm worthy of love, compassion, understanding, and then more specifically, how those things come. Once we have that self-worth, then we have a better self-esteem. Once we have a better self-esteem, we feel good about ourselves, we feel more confident. And once we have that confidence, then we are able to make those changes that we need to get through those difficult times. So that's what I do as a therapist. And I know that these are some of the, they tell me that it works from a psychological or a physiological aspect, rather. There are clinical studies that show that if we talk to ourselves in that compassionate and loving way, that we actually have physical reaction within our body. We've got positive hormones that are released throughout the body, making us feel good. But more importantly, giving our bodies that recognition and that signal that, yeah, we're feeling good, everything's going well. And of course, the opposite is true, right? So if we do the negative talk, we get physiologically physical negative response. So it just makes sense to have that positive affirmation. So what I usually do for it is I help them write their affirmation. And it could be something just as simple as, you know, or I'll tell them to write this down and I'll say, you know, Gina, I love you. Gina, I'm here for you. I promise to take better care of you. I promise to put you first. I promise to make sure that, you know, we're okay. You're okay. And in saying these things out loud, you are being heard essentially by your body. Your body is taking in that positive affirmation. The particular expressions that we use to talk to the people that we care about, right? We show affection and understanding and compassion to many people in our world. So it just makes sense to kind of put that in on yourself and give yourself that same kind of love and compassion and understanding and support. So that I think anybody's capable of that, but it just takes work. It's not something that comes naturally, I think, to most people. So, but that I think is the fundamental basis of all the therapy that I do, and I think it can help anybody.